Welcome to the breastfeeding promotion and support in a baby-friendly hospital. Session 5: Birth Practices and Breastfeeding. Objectives: describe how the actions during labor and birth can support early breastfeeding. Explain the importance of early contact for mother and baby. Explain ways to help initiate early breastfeeding. List ways to support breastfeeding after a cesarean section. Discuss how breastfeeding hospital initiative practices apply to women who are not breastfeeding. Labor and birth practices to support early breastfeeding. Step 4 of the 10 steps to successful breastfeeding states help mothers to initiate breastfeeding within a half hour of birth. This step is now interpreted as place babies in skin-to-skin contact with their mothers immediately following birth for at least an hour and encourage mothers to recognize wherein their babies are ready to breastfeed, offering help if needed. Practices that may help a woman to feel confident, in control, supported, and ready to interact with her baby who is alert. These practices include emotional support during labor, attention to effects of pain medications on baby, offering light foods and fluids during early labor, freedom of movement during labor, avoidance of unnecessary cesarean section, early mother-baby contact, facilitating the first feed. Practices that may hinder mother and baby early contact and the establishment of breastfeeding include requiring mother to lie in bed during labor and birth, lack of support, withholding food and fluids during early labor, pain medications that sedate mother or baby, episiotomy, intravenous lines, continuous electronic fetal monitoring, and other interventions used as routine without medical reasons, wrapping the baby tightly after birth, and separating the mother and the baby after birth. Support during labor. A companion during labor and birth can reduce the perception of severe pain, encourage mobility, reduce stress, speed labor and birth, reduce the need for medical intervention, increase the mother's confidence in her body and her abilities. The support can result in increased alertness of baby as less pain relief drugs reach the baby, reduced risk of infant hypothermia and hypoglycemia because baby is less stressed and thus using less energy. Early and frequent breastfeeding and easier bonding with the baby. The labor and birth companion can be a mother, sister, friend, family member, or the baby's father or member of the health facility staff who needs to remain continuously with the woman during the labor and birth. The companion provides non-medical support that can include encouragement to walk and move in labor, offering light nourishment and fluids, building the mother's confidence by focusing on how well she is progressing, suggesting, suggesting ways to keep pain and anxiety manageable, providing massage, hand-holding, cool clothes, and using positive words. Pain relief. Offer non-medication methods of pain relief before offering oral medication. This includes labor support, Walking and moving around, massage, warm water, verbal and physical assurances, quiet environment with no bright lights and as few people as possible. In laboring and giving birth, positioning, which is the mother's choice. Pain medications can increase the risk of longer labor. Operative interventions, delayed start of mother-to-baby contact and breastfeeding, separation of mother and baby after birth, sleepy and hard to arouse baby, diminished sucking reflex, reduced milk intake, increasing the risk of jaundice, hypoglycemia, and low weight gain. Extra time and assistance may be needed to establish breastfeeding and bonding if pain medications are used. Light foods and fluids during labor. The woman needs energy to do labor and birth. There is no evidence that withholding of light food and drink from low-risk women in labor is beneficial as a routine practice. The desire to eat and drink varies, and a woman should be allowed to decide if she wants to eat or drink. IV fluids for women in labor need to be used only for a clear medical indication. Fluid overload from the IV can lead to electrolyte imbalance in the baby and high weight loss as baby sheds the excess fluid. An IV drip may limit the woman's movement. Following a normal birth, a woman may be hungry and she should have access to food. If she gives birth during the night, some food should be available for her so that she does not need to wait many hours until the next meal is available. Birth practices. When giving birth, all women need a skilled attendant present. Minimal use of invasive procedures such as episiotomy. Universal precautions to be followed to prevent transmission of HIV and blood-borne infections. Cesarean sections or any other intervention used only when medically required. Instrumental delivery, like forceps or vacuum extraction, can be traumatic, disrupt the alignment of bones in the baby's head, and affect nerve and muscle functions, resulting in problems with feeding. Normal vaginal birth is assisted by women being mobile during early labor with access to foods and fluids and by being in an upright or squatting position for birth. Episiotomy will result in pain and difficulty in sitting during the early days after birth, which can affect early skin-to-skin contact, breastfeeding, and mother-baby contact. The cord should not be clamped until the pulsing reduces and the baby has received sufficient additional blood to boost iron stores. Importance of early contact, skin-to-skin contact. Ensure uninterrupted, unhurried skin-to-skin contact between every mother and unwrapped healthy baby. Start immediately, even before cord clamping, or as soon as possible in the first few minutes after birth. Arrange this skin-to-skin contact continue for at least 1 hour after birth. Skin-to-skin contact calms the mother and the baby and helps to stabilize the baby's heartbeat and breathing. It keeps the baby warm with heat from the mother's body. It assists with metabolic adaptation and blood glucose stabilization in the baby. Reduces infant crying, thus reducing stress and energy use. It enables colonization of the baby's gut with the mother's normal body bacteria gut. provided that she is the first person to hold the baby and not the nurse or the doctor. Facilitates bonding between the mother and her baby, as the baby is alert in the first 1 to 2 hours. After 2 to 3 hours, it is common for babies to sleep for long periods of time. It allows the baby to find the breast and self-attach, which is more likely to result in effective suckling than when the baby is separated from his or her mother in the first few hours. All stable babies and mothers benefit from skin-to-skin contact immediately after birth. All babies should be dried off as they are placed on the mother's skin. The baby does not need to be bathed immediately after birth. Babies who are not stable immediately after birth can receive skin-to-skin contact later when they are stable. Overcoming barriers to early skin-to-skin contact. Many of the barriers to skin-to-skin contact are related to common practices rather than to a medical reason. This includes concern that the baby will get cold. Then dry the baby and place baby naked on the mother's chest. You may put a dry blanket over both the baby and the mother. Baby needs to be examined. While most examinations can be done with the baby on the mother's chest, where the baby is likely to be lying quietly. Weighing can be done later. Mother needs to be stitched. The infant can remain on the mother's chest if an episiotomy or cesarean section needs to be stitched. Another reason baby needs to be bathed. Delaying the first bath allows for the vernix to soak into the baby's skin, lubricating and protecting it. Delaying the bath also prevents temperature loss. Baby can be wiped dry after birth. Delivery room is busy. If the delivery room is busy, the mother and baby can be transferred to the ward in skin-to-skin contact, and contact can continue on the ward. No staff is available to stay with the mother and baby. A family member can stay with the mother and baby. Another reason baby is not alert. If the baby is sleepy due to the maternal medications, it is even more important that the baby has contact, as he or she needs extra support to bond and feed. Mother is tired. A mother is rarely so tired that she does not want to hold her baby. Contact with her baby will help the mother to relax. Mother does not want to hold her baby. If a mother is unwilling to hold her baby, it may be an indication that she is depressed and, and at greater risk of abandonment, neglect, or abuse of the baby. With twins, the interval between the birth varies. Generally, the first infant can have skin-to-skin contact until the mother starts to labor for the second birth. The first twin can be held in skin-to-skin contact by a family member for warmth and contact while the second twin is born. Then, the two infants are held by the mother in skin-to-skin contact and assisted to breastfeed when ready. Helping to initiate breastfeeding. Help mother to recognize these pre-feeding behaviors or cues. The behaviors of the baby includes a short rest in an alert state to settle to the new surroundings, bringing his or her hands to his or her mouth and making sucking motions, sounds, and touching the nipple with the hand, focusing on the dark area of the breast, which acts like a target. moving towards the breast and rooting, and finding the nipple area and attaching with the mouth wide open. There should be no pressure to mother or baby regarding how soon the first feed takes place or how long a first feed lasts, how well attached the baby is, or how much colostrum the baby takes. The first time of suckling at the breast should be considered an introduction to the breast rather than a feed. More assistance with breastfeeding can be provided at the next feed to help the mother learn about positioning, attachment, feeding signs, and other skills she will need. The role of the health worker at this time is to provide time and a calm environment. Help the mother to find a comfortable position. Point out positive behaviors of the baby, such as alertness and routine. Build the mother's confidence and avoid rushing the baby to the breast or pushing the breast into the baby's mouth. Ways to support breastfeeding after a cesarean section. A cesarean section is a major abdominal surgery. The mother is likely to be frightened and stressed, have an IV drip and urinary catheter inserted, be confined to bed and restricted in movement, have restricted fluid and food intake both before and after the birth, thus be deprived of energy to care for her baby, receive anesthetics and analgesia for pain, which can affect the responses of both the mother and the baby, have altered levels of oxytocin and prolactin, the hormones of lactation, be at higher risk of infection and bleeding, be separated from her baby, and feel a sense of failure that her body was not able to work normally to give birth. The baby is also affected by cesarean section birth. The baby is at high risk of not breastfeeding or of breastfeeding for only short duration. Baby may have more breathing problems, may need suction of mucus which can hurt the baby's mouth and throat, may be sedated from maternal medications, less likely to have early contact, more likely to receive supplements, more likely to have nursery care, increasing the risk of cross-infection, as well as restricting breastfeeding. The presence of a supportive health worker is important for helping a mother initiate breastfeeding after a cesarean section. Ways to support breastfeeding after cesarean section: encourage the mother to have skin-to-skin contact as soon as possible. Mothers who have spinal or epidural anesthesia are alert and able to respond to their baby immediately, similar to mothers who gave birth vaginally. Following a general anesthesia, contact can occur in the recovery room if the mother is responsive, though she may still be sleepy or under the influence of anesthesia. The father or other family member can give skin-to-skin contact, which helps keep the baby warm and comforted while waiting for the mother to return from the operating room. Babies who are premature or born with a disability also benefit from skin-to-skin contact. If a baby is not stable and needs immediate attention, skin-to-skin contact can be given when the baby is stable. Assist with initiating breastfeeding when the baby and mothers show signs of readiness. The mother does not need to be able to sit up or hold her baby or meet other mobility criteria in order to breastfeed. It is the baby that is finding the breast and suckling. Help cesarean mothers find a comfortable position for breastfeeding, like side lying in bed, sitting up with a pillow over the incision, or with the baby held along the side of her body with the arm closest to the breast. Lying flat with the baby lying on top of the mother, or support like pillows under her knees when sitting up, or under the top knee and behind her back when side lying. Provide rooming in with assistance as needed until the mother can care for her baby. When staff are supportive and knowledgeable, the longer stay in hospital following a cesarean section may assist in establishing breastfeeding. Session 5 Summary. Step 4 of the 10 steps to successful breastfeeding states help mothers to initiate breastfeeding within a half hour of birth. This step is now interpreted as place babies in skin-to-skin contact with mothers immediately following birth for at least an hour and encourage mothers to recognize when their babies are ready to breastfeed, offering help if needed. Practices that result in a woman feeling confident, in control, supported, and ready to interact with her baby who is alert help to put this step into action. Encourage a family-centered maternity care approach at birth with involvement of the father or close family member during delivery.